So that's just preparing now. So we'll be live in a few seconds. Good afternoon. Welcome to this Healthwatch Bury live. My name is Catherine and I'm an engagement officer at Healthwatch Bury. Today we're joined by Paul from the VCFA, who's going to be talking more about World AIDS Day and living with HIV, and he'll also be sharing resources about local support groups. So I'm just going to start with some information about Healthwatch Bury. So I'll just load up my slides. So hopefully you can see these slides now. I just want to start with our live streaming guidelines if you're commenting today. So you can comment with questions for Paul. Just make sure that they're in line with our guidelines, which I'll be accepting, respect boundaries, and don't be rude. And we also moderate on any recordings of this video as well, because we will be uploading to our YouTube channel once the live is finished today. And remember, this isn't the place to promote your products, and make sure to keep your comments clean and don't post anything shocking or obscene, because those will be removed by our moderators. So today I'm just going to start with an introduction to Healthwatch Bury, who we are, what we do, and how we can support you. And Paul has prepared a short talk for you today. And at the end, we're going to do a Q&A with Paul about World AIDS Day and living with HIV. So if you have any questions, you can pop those in the comments below and Paul can answer those at the end. So Healthwatch is your local health and social care champion. Our aim is to improve healthcare services for people who use them. We also provide information and signposting. We listen to your experiences of using health and social care services and share those with key decision makers to help improve them for you. And ways we can support you include signposting to services for HIV screening. And we can also help you find an LGBTQ+ friendly GP. We can also signpost you to local support groups. Most importantly, we can listen to your experiences of using health and care services in Bury. I also wanted to talk about a workshop that we are doing with the LGBT Foundation, which is going to take place next Monday evening at 6 o'clock, virtually via Zoom. And this workshop is about LGBT sexual health and well-being. And this is an introductory workshop for people who want to learn more about LGBT sexual health. So you can register for that via Eventbrite, and I've put the link to that in the description of this video. And if you want to contact us today, our number is 0161 253 6300, and our email is info@healthwatchbury.co.uk. This is our Facebook page, so make sure you've liked or followed this page so you can stay up to date with everything going on in Bury. We also have a YouTube channel where we upload our recordings of our live streams. So subscribe to that channel so you don't miss out. And we also have a Twitter, which is @HealthWatchBury. So I'm going to pass you over to Paul, who is going to talk to you more about the plans in Bury for World AIDS Day and his experiences of living with HIV.
Thanks very much. Good afternoon, everybody. My name is Paul Fairweather, and I started working in the middle of July for the VCFA as their LGBTQI worker. And my job is basically, I'm working 2 days a week, and there's two elements of my job. The first is very much supporting the LGBTQI forum, but also other social groups in Bury. So it's working with the community, identifying any gaps in provision and supporting the work that they've been doing over the last 3 or 4 years. And the other element of my work is working with organisations, in particularly working with the voluntary sector, working with the health sector, and working with the council. There's an element to my funding, there's an element to my role around community safety and hate crime and domestic violence. So I've also been working with the police to increase information about hate crime and how you report hate crime. But clearly one of the things I've been working on with the forum is World AIDS Day. And we've got a great event coming up on Wednesday, this Wednesday, the 1st of December, World AIDS Day, which is from 12 to 2 at Bury Met. And we've got the Mayor, Councillor Tim Pickstone, is coming to welcome people and talk a bit about his support for HIV work in Bury and HIV charities. We also have Darren Knight, who's the Chief Executive of the George House Trust, and he's coming to talk about the work that they're doing across Greater Manchester. And he's also going to introduce 3 short films called HIV and Me, which have been made by GHT in conjunction with DB Theatre Group. And that tells the stories of 3 different individuals living with HIV and challenging stigma. I need to declare an interest. One of the films is about me, but there's also about a guy called Mark, who's a heterosexual man, who's an ex-injecting drug user, and a woman called Yvonne, who does a lot of work with women living with HIV. So this is a free event. You can book onto it through the Bury Med website, and we'll be providing lunch and refreshments. And we also have Leslie Jones, who's the Director of Public Health in Bury. So she's going to be talking about services in Bury and work being done locally around supporting people living with HIV. So do come along to that if you can. It's a free event, and you'll find more information about the work that the Bury LGBT Forum is doing, but also work going around HIV in Manchester. As I said, I only work 2 days a week for VCFA. So the other time, I actually, for the last 5 years, have managed the Positive Speakers Project at the George House Trust. And the George House Trust is the largest organisation in Greater Manchester supporting people living with HIV. And at the Positive Speakers Project, I work with a great group of volunteers, and we talk to lots of different organisations around our experiences of living with HIV. I was diagnosed in 2000, so I've been living with HIV over 20 years. And a bit later in the live stream, I'll talk a bit more about my personal experiences. But we, particularly in the last 3 years, we've been concentrating on working with young people. We've had some funding to work with schools, and we've done sessions in schools where we talk to a whole year group. So for example, recently we ran 14 sessions at a secondary school in Manchester and talked to all their year 10 pupils. And what we do in the sessions, we talk about the difference between HIV and AIDS, which people still get confused about. We talk about routes of transmission, how you can catch and can't catch AIDS. And we talk about challenging stigma. And we also show a great video, which is young people living with HIV talking about their own experiences. And then one of our positive speakers will tell about their life story, will tell about their journey of living with HIV. And then we get lots of questions normally from the young people. And I think it's really important that young people have a chance to find out more about HIV, but also to listen to people with HIV talking about their experiences. We've also had some funding to run these sessions for GP and health and social care professionals across Greater Manchester. And we're really keen to talk to GPs. I've run some of these sessions for GPs in Bury. And again, they're for the health staff. It's not just for the doctors, but it's for the nurses, the reception staff and the admin staff. And again, it's a similar formula, but it's important that everyone working in health and social care is aware of the latest developments around HIV. I'll talk a little about the services that George House Trust provide. We work with many volunteers, but we also provide a lot of support to people who are newly diagnosed. When you first get an HIV diagnosis, it can be very traumatic. And although these days the medical treatments are very effective and it's a completely manageable condition, the stigma, self-stigma and isolation can still be considerable. So if people are diagnosed, we encourage their consultants to refer them to George House Trust, and we're able to provide a lot of one-to-one support for people. But we also run a group called Living with HIV, which gives a lot of information, not only about the medical aspects of the disease, but how to manage the relationships with your family, friends, colleagues, and potential partners. We also run some specific support groups. We have a group for children and young people who've been born living with HIV, and we do support with them. We have a women's group, we have a group for gay men, and we have a group for African people. We also have a welfare fund, and many of the people we're supporting are refugees and asylum seekers, have very little access to money, so we run a welfare fund. We have a great volunteer counselling scheme, and we also run a peer mentoring project where people living with HIV can support other people living with the virus. And again, that's a very powerful thing to be able to support other people. We also do a lot of work in terms of training and education, and the positive speakers work is very much around challenging stigma and discrimination. Because although there have been enormous changes in the last 40 years, there's still ignorance and hostility and fear and stigma sometimes affects people living with HIV. I'll talk a little bit about the history of the epidemic. I've been involved in working around HIV since the early 1980s. And in 1985, I was one of 6 gay men who set up Manchester AIDS Line as a telephone helpline, which has since become the George House Trust. And in those earliest days of the epidemic, there was a huge amount of fear and ignorance around HIV. Initially, I remember in the early 1980s, reading about HIV in the gay American press. It was affecting small groups of young gay men in San Francisco and New York. And at first it was called GRID, it was called gay-related immune deficiency, because people thought it only affected gay men. That soon became clear that was not the case. But again, in the early days in the 1980s, there were no treatments, there was no medication. People weren't clear about what caused the virus and how it was transmitted. So I certainly saw friends of mine who were young, healthy gay men in their 20s contracting HIV and died relatively quickly. Towards the late 1890s, combination therapy arrived. The first drug was a drug called AZT, which is very toxic and actually very difficult to take and not that effective. So it was only with the advent of what's called combination therapy that the drugs really began to work. Combination therapy, there's 3 different types of drugs that attack the virus in different ways. And that means that nowadays, when people are diagnosed, they're put on treatment straight away, and actually it's very much a manageable situation. I'll talk a little bit about my own experiences of living with the virus. I was diagnosed in 2000, and when I was first diagnosed, my viral load, which tells you how much of your virus is in the body, was 750,000. So there was a lot of virus in my body. I was very, very infectious. And my CD4 count, which measures how strong your immune system is, was just under 200. So it was very low. And I started taking medication the first day I was diagnosed. And in those days, I was taking 16 tablets a day, some at night, some in the morning, some with food, some without food. But within 6 months, I became what was called undetectable. So my viral load had gone from 750,000 to under 50. And basically what that means, and what that's been proven to mean now, is that if you have an undetectable viral load, that you cannot transmit the virus to anybody. And I think that's really significant for those of us living with HIV, because it means in terms of HIV transmission, we are the safest people you could meet. You might meet someone who says they're HIV negative, but they've never had an HIV test. They assume they're negative. They might, in fact, be living with HIV and be very infectious. You might meet someone who has said they had an HIV test and it was negative, but that might have been a year ago, that might have been 6 months ago. And again, they might have become infected since. So in terms of being absolutely confident that you cannot catch HIV from anyone, the safest people you can meet are those of us living with HIV who are undetectable. And one of the key messages we get across to people in the work that we do through George House Trust and through the Positive Speakers Project is the U equals U message, which is undetectable equals untransmittable. Because as I say, there's been major research in the last 5 years, and it's shown without any doubt that if you're undetectable, you cannot transmit the virus. And in this country, 95% of people living with HIV are undetectable. So I think that's really important for those of us living with HIV in terms of our own mental health and well-being. Because although there's been huge changes in medication, there is still some stigma and discrimination around living with HIV. And I know when I was first diagnosed, you have to take a decision about who do you tell about your status in terms of family, friends, colleagues, potential partners. I decided not to tell my mum because she was in her 80s and she probably would have worried, and I was confident that my health was going to be fine. I told my sister who was fine. I told my friends, most of whom were fine. And I told my boss at the time, who was very supportive. The thing to stress is that HIV is covered under disability and equality legislation. So even if you're living with HIV and completely well, have no symptoms, you are classed as a disabled person and you cannot be discriminated against. You can't lose your job. You can't be sacked for living with HIV, and you can't be denied any services. And if you're an employer, you need to make what's called reasonable adjustments. So for example, a friend of mine was diagnosed quite recently. He started the medication. One of the side effects of the medication can be quite bad diarrhea. So he was experiencing that. So his employers actually moved his office so he was near a toilet. So that's a very practical, a very helpful thing an employee can do that counts as a reasonable adjustment. But although there's no, you can't discriminate against people under the law, that doesn't mean that discrimination doesn't happen. We dealt with a case at GHT recently of a young gay man who was diagnosed at 17, and he told his line manager that he was HIV positive, and he worked in a small cafe, and without telling this young man, his boss brought all the other staff together, told them he was living with HIV, told them he'd be unable to work and touch food, which is completely wrong and completely illegal. So it's really important that people have the true information around HIV and AIDS. HIV is a very difficult virus to catch. It dies very quickly outside the body. It's only transmitted in a very specific number of ways, mainly through unprotected sex, through injecting drugs, if you're an injecting drug user, through sharing needles, and mother to baby. But in this country, every woman who's pregnant is offered an HIV test. If she's found to be HIV positive, she will be given HIV medication, and that will prevent the baby from being born positive. So it's very rare in this country for babies to be born living with HIV. In terms of the stigma and discrimination, the isolation, that can still be very damaging. So what we do when we encourage working with consultants or GPs, if they're telling someone they're living with HIV, we would encourage them to refer people to George House Trust. It's a very simple referral process. Anyone can refer, or professionals can refer, by going on our website and just making a very simple referral. And we will aim to see people newly diagnosed very quickly, give them a lot of one-to-one support, and also link them in with a range of organisations that can give them a lot of support. And I think the other thing I'll mention again is the U equals U message, the undetectable equal untransmittable. We've had a major campaign recently to highlight that message through social media and to lots and lots of different communities. And Andy Burnham, as the Mayor of Greater Manchester, has made a very public commitment to end all new cases of HIV by 2030. Because although there's not a cure, there's not a vaccine, and if I stop taking my medication, the HIV will gradually reappear and I will become ill, that the overwhelming majority of people in this country are on medication that's effective. So it's certainly possible that within a generation, HIV will actually disappear as a disease and there will be no new cases. And there's also PrEP, which is antiretroviral drugs that you can take if you think you might be at risk of contracting HIV. It's recently become available on the NHS in England, but even before then, certainly amongst the gay community, a lot of gay men were buying PrEP online, and we saw a very dramatic reduction in the number of new cases of infection. So if you think you might be at risk of contracting HIV, you can take an antiretroviral drug which prevents you from becoming infected. So the combination of most people being undetectable and more people at risk actually taking PrEP means that it's very possible that HIV will disappear as a disease within the next generation. One of the key reasons to make sure that happens is to avoid any late diagnosis. There are still a few cases in this country of people actually developing AIDS and dying, and that's mainly because they do not have, their GPs or other medical people have not identified their HIV positiveness in time. So, for example, we recently supported a 75-year-old woman who was a heterosexual woman who was a widow and who had a lot of unexplained weight loss. She was losing lots and lots of weight. She went to a GP. They couldn't work out what was going on. She was referred to specialists, and again, they couldn't work out what was happening. When she was finally given an HIV test, her immune system had been too destroyed. She developed AIDS, and she went on and died of AIDS. And this is a diagnosis that was completely preventable if her GP had thought about offering an HIV test, because weight loss, unexplained weight loss, is one of the key symptoms of HIV diagnosis. But because the woman was 75 and because she was heterosexual, the GP assumed that she couldn't possibly be HIV positive. And it's really important to test that it only needs one unprotected sexual encounter to become infected, regardless of your age or your sexuality. One of our young positive speakers was diagnosed when he was 16, the very first time he had sex. During his first relationship, the first time he had sex with anyone, he became HIV positive. So it's really important that people take up opportunities to have an HIV test. You can get one at your GP, you can get one to a sexual health clinic, you can send away for one in the post, and it's a very simple test to take. So we would really encourage anyone who thinks they might be at risk of becoming infected with HIV to have a regular HIV test, to take PrEP if they think they might be at risk, and if they do become positive, to actually make sure they link in with George House Trust and other organisations supporting people living with HIV. I'll talk a bit about World AIDS Day. World AIDS Day is an event that is used to remember people who died of AIDS and also support people living with HIV currently. It's celebrated throughout the world. People might have seen the red ribbon, which is a symbol of people living with HIV. I say locally in Bury, we have an event at Bury Met at lunchtime on the 1st of December between 12 and 2. It's a free event, you can book online. In Manchester, there's a vigil for World AIDS Day in Sackville Park in the Gay Village. I'm actually speaking at that event. I'm speaking about 40 years of HIV activism, but there'll be a number of speakers, there'll be singers, and then people will actually light a candle and remember people that we've lost to AIDS and remember people currently living with HIV. We have had a few questions before the presentation, so I'm just going to deal with these questions now, and then if there's any other questions, hopefully people can put those in the chat. One of the questions was, is there still stigma around living with HIV? And I would say that actually, unfortunately, that is still the case. There is still ignorance around HIV, there's still prejudice, there's still assumptions that people make. For older people, they might remember the days in the 1980s when there was the Don't Die of Ignorance campaign. There were tombstones going through people's letterboxes. And we certainly run sessions with older people who are still convinced that an HIV diagnosis is a life sentence. Still, many people don't know how HIV is transmitted. They don't know that 95% of people living with HIV cannot transmit the virus. They don't know that HIV is a very difficult virus to catch. It's very unlike the COVID virus. It dies very quickly outside the body, and there's very specific ways it can be transmitted through sex, through sharing needles if you're an injecting drug user, and mother to baby. There's another question about support for mental health issues, depression, that people get isolated. When you receive an HIV diagnosis, it can be a huge impact in your life. People can get very isolated, and the self-stigma can be more damaging in some ways than the disease. Certainly, I know people who, on receiving a diagnosis, have locked themselves away. Basically, they've stopped having any relationships. They're scared of going out to meet people. Their health is fine, but their mental health is very bad. So we offer, a peer support project at George House Trust, where people living with HIV support people, other people living with HIV who might be having mental health issues. We have a very good counselling session, so people can have one-to-one counselling. And again, we work with consultants, and again, people can be referred to counselling through the NHS. And then another question is around my experiences and people's experiences of healthcare professionals. In the main, I think that's been very positive. There have been some exceptions. For example, when I told my dentist I was living with HIV, he asked me to always make an appointment at the end of the day, as if he had some magical equipment he could use to make sure he was safe. And that's completely unnecessary. There's never been a case anywhere in the world where a dentist contracted HIV from examining their patients. Dentists, like most healthcare professionals, should take very clear precautions around protecting themselves from any infections. So actually, it's completely unnecessary to ask anyone to have a last appointment in the day. And for people living with HIV, it's clearly very stigmatizing. There's also sometimes issues around confidentiality. You don't need to tell your GP you're living with HIV. We would encourage people to do so because there can be, if your GP is prescribing other medication, there can be issues that impact your HIV drugs that you're on, but you don't need to. And I think confidentiality is really important. Friends of mine have been in hospital in a ward, a crowded ward, and the consultants have come round, talked in a loud voice about their HIV status, so outing them to other people in the ward. A friend of mine, she was in hospital and someone came to visit her who didn't know she was HIV positive, but on the notes at the bottom of the bed, which she could read, it said in big letters, HIV positive. So people need to be aware of issues around confidentiality. Certainly in the 1980s and the earliest days of the epidemic, I think people involved in HIV activism created a new relationship with GPs. I remember sitting on a committee in North Manchester in the mid-80s with GPs and consultants, and actually speaking with them, arguing with them, challenging them, saying they needed to be very much involved. And I think the relationship between the patient experience and the GP epitomised through the HIV epidemic has been really important, and it's changed the way that medical professions deal and relates with people's lived experiences. So I think the lived experiences of people living with HIV are now much more part of the picture, really. I'm going to stop there and see if there are any more questions that come up in the chat, but hopefully that's been useful for people.
Yes, thank you, Paul, for sharing your own experiences and all the services that the George House Trust provides. I don't think we have any further questions right now, but we will be compiling information into a blog post to go with this video, and we'll also be sharing more information on our Facebook page as well. If people have further questions about where to get tested for HIV or want to know more information, they can contact us, Healthwatch Bury, and you'll find our contact details in the description of this video. So I'm probably going to end the live now. Thank you, Paul, for joining us today. And remember that the World AIDS Day event is at the Met on Wednesday at 12, and I will be attending that event, and I'm looking forward to it. Okay, hope you have a nice rest of your day.
Great.
Okay. Goodbye.